Welcome to Horizonte, a show that takes a look at current issues through a Hispanic lens. It's no secret that 32% of Hispanic and Latino Americans make up the population in Arizona. What is a mystery is how many Hispanic doctors are in the state's healthcare system to handle this growing community. It's a national crisis. Complicating the drastic shortage of Spanish-speaking doctors are patients struggling to access proper care due to cultural differences, translation issues, and lack of trust in the healthcare system. Hello, I'm Catherine Anaya, and in this special episode of Horizonte, we're featuring a documentary film that explores the issue of healthcare disparities with the Hispanic community. In the Working Nation film, Hispanic Doctors Missing from Medicine, we get a glimpse of the personal journey of a young Latina in Houston, who makes it her mission to be part of the solution by becoming a doctor. Through the lens of this documentary, we want to have a conversation examining how to find health equities for Latinos right here in Arizona. But first, let's get into the film.
Crece la preocupación de algunos legisladores estadounidenses ante la actual escasez de personal médico.
De acuerdo con el último reporte de la Administración de Servicios y Recursos de Salud, se necesitan 17,000 médicos primarios. Esta escasez de doctores se vive especialmente con mayor agudez en las comunidades latinas y afroamericanas.
The Latino population has a lot of very specific healthcare challenges that aren't necessarily felt with other demographics. For example, Hispanics in the state of Texas are more than twice as likely to be obese than non-Hispanic white children. 50% of Latino children will develop diabetes in their lifetime. Houston is where the United States is going to be within the next few decades.
A mí hace 13 años me diagnosticaron con cáncer y recuerdo que era una médica que no era latina, pero ella me envió un correo electrónico diciéndome que tenía cáncer, que sacara una cita para mi cirugía, pero ni siquiera me lo explicó.
Diabetes es común en mi familia, también la hipertensión y mi abuelo que falleció de un ataque de corazón. Esas cosas sí me da miedo.
Muchas veces las personas que hablan español no se atreven tal vez a buscar ayuda porque las personas tal vez no creen que puedan encontrar recursos en español.
As the fastest growing population in the United States, we will need Latinos to be able to fill doctor roles and healthcare professional roles, just naturally with the way that our demographics are changing in the United States.
No hay médicos latinos suficientes. Desafortunadamente, en los Estados Unidos somos 6% los médicos hispanos. En Texas un poquito más alto, 11%. A medida que va pasando el tiempo, la población hispana va creciendo, pero la población de médicos hispanos no está creciendo.
Y conseguir un médico hispano es muy difícil porque casi aquí no hay. Es como buscar una aguja en un pajar. Nunca he preguntado por qué no hay más médicos hispanos. Nunca, la verdad que no se me había ocurrido preguntar eso. Pero sería bueno preguntar.
Crecí en una comunidad donde estábamos en bajos recursos. Mis hermanas tenían ataques de asma y nos tocaba ir al hospital, pero me recuerdo que a veces también a mí me tocaba de vez en cuando tratar de entender lo que me iba diciendo el doctor para trasladar a mi mamá. Yo tenía como 8 a 10 años. Ellos trataban de explicármelo como en palabras como yo de niña poder entender, pero también a veces se me olvidaba yo la palabra en español, entonces yo solo me quedaba viendo y yo digo, creo que tiene problema aquí aquí.
La comunicación en medicina, para ser tú un buen médico, puedes tener un plan excelente, pero si tú no lo puedes comunicar no vas a lograr que el paciente se adhiera a ese tratamiento o a ese plan.
Cuando tú vas a un consultorio de un médico americano, ellos se conectan con una compañía que se llama intérpretes. Lo que tú le has dicho a la traductora no le dice. Yo el inglés medio que lo entiendo. Entonces yo la escucho a ella, no puedo entender porque no me lo está diciendo todo. O cuando la doctora dice algo, tampoco me lo dice completo.
There is a correlation that if you have a Latino doctor, that they're going to take care of Latino patients better. It is very important that we do have Latino doctors treating Latino patients because of the implicit bias that exists in society.
It's real easy to say, your weight is up. You need to lose weight. You need to take your pills. And I said, have you ever sat in the shoes of some, particularly Latinos? You're up at 6 o'clock. Well, you're at work at 6 o'clock. And you work all day, manual labor, it's hot. And you get whatever food is there.
Mis papás han tenido que pasar por muchas adversidades en su vida. Mi papá trabaja como manejador de bus y mi mamá trabajaba como mesera, creo que desde que llegó a este país, y después ya recientemente se hizo general manager del IHOP donde trabaja ella. Y yo soy la mayor, entonces todo he vivido yo con ellos. Nosotros cuando ellos recién llegaron y había nacido yo, dormíamos en un apartamento de una recámara en el piso porque no teníamos el dinero. A veces pasaban como días de no ver a mi papá porque le tocaba trabajar como 2, 3 trabajos. De vez en cuando, por ejemplo, en mi familia era más como nos tocaba pagar renta o nos tocaba ir al doctor. Y mayoría del tiempo, por ejemplo, si mi mamá estaba enferma, ella decía, no, tengo que ir a trabajar, no importa. Ella, aunque estuviera con una fiebre de 104, todavía se iba al trabajo porque a veces el sistema médico es más como un privilegio que un derecho. Mis hermanitos también sufrieron mucho de asma cuando eran chiquitos. Todo lo del polvo, todo el mold y todo eso, fueron ellos muy exposed to that y no les ayudó mucho en el asma. Mi más grande motivación de estudiar medicina siempre ha sido mi hermanito. Mi hermanito Ethan, cuando él nació, como unas 2 semanas después, se le había cerrado el intestino pequeño. Entonces todo lo que consumía se lo vomitaba de regreso. Y nos dicen, es capaz que se vaya a morir. Y viendo toda esa experiencia, siempre se ha quedado conmigo. Creo que son todas esas cosas, recordándome por qué quiero estudiar medicina, recordando de mi familia, teniendo ese apoyo, que me ha ayudado todavía a motivarme a continuar a estudiar medicina.
I've always loved to learn. I always valued education. It's been important to me since I was a little girl. My parents were born in Sináparo, Michoacán, in Mexico. And my dad started working in the fields in then Arizona. Well, I think for myself, I never imagined that I can be a doctor. I didn't see doctors around me. And growing up in East Oakland, California, it's a very rough neighborhood, a lot of violence and poverty there. Thinking about I want to be a doctor, it's hard for it to happen in places like that.
Thank you for joining us for this special episode of Horizonte and the presentation of the short film Hispanic Doctors Missing from Medicine. We'll get back to the film shortly. We saw that Vilma's brother's illness and how she had to translate for her parents at such a young age fueled her quest to get into medicine. Rebecca Soto Caballero, who is a medical student and with the Latino Medical Student Association, understands Vilma's journey. Also joining me for this conversation is Dr. Jesse Bracamonte, who practices family medicine at the Mayo Clinic, Arizona. Doctor, you are very passionate about the need for more Latino and bilingual physicians. How dire would you say the situation is here in Phoenix and Arizona?
It's quite dire. There's definitely a need. There's a lack of Hispanic physicians to keep up with the growing community. A lack of Hispanic physicians just allows for poor outcomes. There's not enough care to be provided to this special community that desires preventive healthcare needs and with a multicultural, competent care.
And how would you describe the trickle-down effect on Arizona when it comes to the economy and the workforce when you don't have enough of these Latino and bilingual physicians?
That's a great question. There's significant trickle-down effect. So with individuals that don't get the care they need from lack of trust in the system, not having adequate, competent healthcare physicians that can represent and treat those individuals, there's just a lack of entry into the system. Therefore, there's higher incidence of chronic illness, lack of productivity, and then actually down cost revenue streams and healthcare burdens on the healthcare system overall.
Well, and you had also mentioned to me previously that it can lead to absenteeism too with children.
Yeah, absolutely. It's a whole trickle down with the family. Preventive healthcare costs go up, lack of work, absenteeism with work and productivity all goes up, and even in some instances, some cancers can go up just because the lack of preventive healthcare access and screenings drop.
Rebecca, what's your experience? I know that you're, a student right now, but you've been in the healthcare industry as a student for long enough that I'm sure you have some impressions of this subject.
Yes, of course. So currently I'm a second-year medical student, cited in Tucson. So I've had some rotations where I could see a little bit more of what we're talking about in this topic. From my experience, even in my preceptors who are my teachers and guiding me through my journey as a second year, I can tell you that out of the 10 of them, only 3 of them are of Hispanic descent.
Wow.
And just to give a little insight more into my class, out of the 90 students, there's only less than a handful of us that are of Hispanic descent. So there's definitely a discrepancy in those numbers that we can take into account for sure.
Absolutely. A serious discrepancy, as you mentioned, Doctor. Talk to me a little bit about the healthcare challenges this kind of discrepancy poses for Latino families and communities in Arizona.
Yeah, so studies have all been documented for decades that those that are of a special culture or that the culture are more likely to seek care from that individual that shares the same cultural beliefs and ethnicity. So when you have that cultural connection, you're more likely to receive the care you need. There's there's more instance of trust in the system, and there's more likely to adherence of the prescription plan rendered, and there's more access to preventive care services. When you have all that, that just provides good care. Lack of such provides inadequacies and lack of that opportunity to provide those care to those needed populations.
And I know Rebecca is shaking her head because you have experience having served as a translator for your parents when it comes to healthcare. How did that experience influence your decision to then pursue a career in medicine?
Yeah, thank you so much for that question. As far as I can remember, I've always been my parents' personal translators. And I remember just having little anecdotes with my mom that she would fear not having me around her because of fear of misinterpretation or fear of embarrassing herself because of her accent or mispronunciation, and overall just the limit of resources that you get because you can't communicate what you're trying to say. So for sure, that's something that I hold very dear in my heart, and the reason why I want more interaction with the Hispanic community, specifically helping patients with the access of healthcare, for sure.
Well, speaking of patients, Doctor, I mean, how difficult is it for patients to find a Latino doctor in their community?
It's overall very difficult. I think for some of us, it's just difficult to finding primary care in general or finding a physician, but yet lack of finding a Hispanic physician can be difficult. They may be just entrusted to what their insurance deems appropriate or what's in their care network. So it is difficult. And it's even more difficult to ensure that physician speaks Spanish or at least has the cultural competencies and knows that background is there so they can have that connection so they can receive the care that they need.
There are so many implications when it comes to this shortage of Hispanic doctors. And Hispanic students, they face systemic barriers while pursuing their medical education. As we return to Hispanic doctors missing from medicine, the film explores different programs, bridging the gap in getting more students into medical school and becoming future physicians.
The medical schools don't have the amount of scholarships and the endowments for people to go in. And so that's one, many Latino students don't want to put themselves in debt for that amount of money, don't qualify for those loans, and frankly, many of them are discouraged when they go to undergraduate to be able to get a pre-med degree because many people will tell them, you're not going to be able to afford to go to medical school.
The cost, I think, is a big barrier for Latinos to pursue medicine. Medical school is extremely expensive. I think the average debt is $200,000 250,000. I'm not really exactly sure, but it's a lot. My parents haven't paid for anything since I left high school in terms of my school or anything like that. So I kind of found my own way. And so they don't know how much it costs, but I'm in a lot of debt. I think that it took me a little longer to get into medical school because I was trying to work and do classes and volunteer and do the research and all of these things at the same time because I didn't want to stop working to focus on school. It was a very scary step. I don't know how to describe it. There's a lot of pressure.
Medical school is a very long process that can be very expensive. Considered our healthcare education was really not built around a consideration of having a Latino population or a Latino student body. So mostly, of course, designed for those that are English speakers from the United States. If you have a family that doesn't have access to a lot of resources, and that can indeed create a huge barrier for kids to make a decision to go to medical school.
Yo soy estudiante de primera generación. Primero mi familia era a la escuela, a la universidad y a la escuela de medicina. Y ha sido un proceso súper difícil porque he tendido que aprender muchas cosas solas. Y aunque tengo el apoyo de mi mamá y mi papá, todavía hay unas cosas que ellos no saben porque no estudiaron acá. Por ejemplo, en la escuela de medicina veo los muchachos que sí tienen padres que son doctores ya. Y digo, wow, ya quisiera yo tener ese conocimiento porque yo vine no entendiendo nada. Creo que eso es porque buscamos tener como una mentor. Por ejemplo, eso es lo que es doctora Caldas por mí. Por la Asociación Médica de Estudiantes Latinos tenemos un programa que se llama MedConnect. Y entonces en ese programa básicamente te pregunta, ok, ¿qué tipo de mentor quieres? Como qué especialidad. Y a mí, como yo quiero ser pediatra, entonces me dieron a la doctora Caldas. Y doctora Caldas ha sido maravillosa. Me ha ayudado mucho aunque tener ese apoyo latina. También para servir como una motivación de ser parte de ese 6% de acierto más grande. Hola, doctora Caldas, ¿cómo está? ¿Cómo está? En verdad. Pasa adelante.
Actualmente soy la presidenta de la Asociación Hispana de Médicos de Houston. Desde que nació la asociación hemos dado becas a estudiantes de medicina. Los estudiantes de high school no terminan la educación, no saben que hay becas para estudiantes de minorías que vienen de minorías. Sus padres no han hecho educación de college. Se gradúan y prefieren empezar a trabajar. No tienen mentores. Entonces, en el 2018 empezó un programa de mentoría a estudiantes de medicina con el objetivo de que ellos pudieran identificarse con un médico semejante a ellos y no solamente con estudiantes de medicina, también con estudiantes de high school y tener un modelo de cómo ejercer una profesión, ayudarlos, motivarlos, inspirarlos, demostrarles que ellos pueden lograrlo, que si quieren lo pueden lograr.
I didn't really have mentors in my life kind of asking me, what are you going to do with your life? Or trying to guide me on that path. So I felt like by the end of college, I was a bit lost. When I was applying to medical school, I met Mi Mentor, which is a national mentoring organization. The program is kind of run and led by doctors who have a similar story to me. They're first generation, nobody helped them, so they struggled. Once I connected with them and I started the medical school readiness program, it just made such a difference. I applied to medical school twice. So the first time I didn't get in, but the second time I got in. And I think Mi Mentor had a lot to do with that. Having mentors that help us and then turning around and helping other people, it will create a ripple effect. But I don't think we'll be able to see it for a few decades, I think.
Y lo otro que también me parece muy, muy importante es que los latinos en el área de salud no estamos en el liderazgo, no estamos en posiciones de liderazgo, no estamos en los boards, no estamos en las políticas que se ejercen sobre salud. Estamos llegando, pero estamos llegando despacito y no al nivel que la población hispana está creciendo. Entonces yo creo que este es un problema multifactorial de educación, de aceptación de que somos una población que está creciendo y que somos minoría, pero estamos siendo mayoría.
It's a complete market failure in terms of healthcare.
You have to make sure policies change and systems change and communities change, and all of that doesn't happen overnight. I'm hopeful that it's heading in the right direction. I think we're slowly going to get there with more Latino doctors. It'll take time. 2 weeks ago, I started residency here at Baylor, and it's been great. It's been fantastic.
Aunque estén difíciles los exámenes, aunque esté costosa esta carrera, solo ver la gratitud que tienen estos pacientes, nadie se los quita, y es algo que quiero continuar haciendo. Ver un paciente irse y decirme gracias, mija, por ayudarme, por estar aquí, eso no se lo puede quitar a nadie. Eso es una bendición, y eso es lo que me motiva a seguir. Quiero ser médica para poder darle voz a mis pacientes y tratar de ayudarlos.
Para nosotros como familia, ella es un ejemplo de perseverancia. Como familias de inmigrantes sabemos que un hijo se te gradúe en este país no es fácil, y verla alcanzar sus sueños al querer ser un ejemplo para las otras personas como hispanos, de decirle, yo sé que no es fácil, pero tampoco es imposible. Lo que sí tenemos son sueños y aspiraciones de llegar a hacer grandes cosas en este país, y no hay nadie que nos las pueda quitar. Love you.
Love you, mami.
Muchas gracias, Sofi. Tienes mucho por delante. Una responsabilidad muy grande.
Sí.
This film is so compelling. And Doctor, I want to talk to you a little bit about your passion for medical education. Do you think that Arizona's medical schools are doing enough to recruit and retain Hispanic physicians?
Well, I think our med schools are definitely made progress. Can we do more? Absolutely. I think our numbers reflect that. There just aren't enough Latino physicians or graduating from med school, or even qualified applicants going into med school to select from the whole applicant pool. We can do more. I think we're giving ourselves maximum effort, but we have to up the ante on that. I think extending programs to have qualified applicants apply to med school will be our future workforce to keep up with the population.
Rebecca, I want to get your thoughts on this, and particularly because you are a student in medical school, are doctors and students getting enough language training when it comes to, being able to speak Spanish with patients?
Of course, yes. So after talking to some colleagues of mine during medical school, I can tell you that there should be more done in regards to providing more official language training. I can tell you a little bit about now that I'm in my Tucson community health site, that we have the opportunity to do an elective for our third-year rotation, and it's called Medical Spanish, but it is an elective and it's not required, so you would have to seek out for it. So again, I think that if it were more encouraged, or even in a requirement, that it would be better to promote more of that language awareness.
Yes, and very critical, right, Doctor?
Yeah, it is, especially in Arizona, where many individuals and patients speak limited English. So, like we all know that with that English to Spanish translation, or just speaking the language, you have better access and you have better health outcomes, I should say. So it's crucial. I think having those programs available, at least making an opportunity for all schools to have that, is a big first step.
Going back to the education for just a moment, Rebecca, you're a member of the Latino Medical Student Association. How critical is that organization to you and others who are med students and who are interested in, becoming more vested in the number of Hispanic and Latino doctors in Arizona.
Yeah, of course. So I can briefly mention my experience and journey as a pre-med in undergrad. I didn't have a community of like-minded individuals who were interested in medicine and also Hispanic. So it was something that I was really looking forward to and to finding in medical school. And fortunately, I did with LMSA, which we call overall, LMSA is an organization nationwide. There's many chapters, and our chapter specifically is focusing over these couple past years to mentor pre-med students and helping guide them and provide them resources, and overall just providing a networkship and also just encouraging them to embrace our culture and spread it, and also just be another person to resonate with our patients in the medical field.
So mentorship is critical to your success.
Yes, for sure.
And you would agree with this, Doctor, because as I mentioned, you are very passionate about medical education. I want to get your thoughts on this topic, but particularly when it comes to first generation students, medical students of Latino descent. You were one of them.
I was.
I mean, tell me about that.
Yeah, I was. It's very dear to my heart and passionate about it because I had somebody encourage me, and being a youngster and just having somebody encourage me and kind of show me the steps early on and show me that this is doable, and to kind of tell me and give me the opportunity to ask those questions was key. Whereas if I didn't know or have that individual, maybe I wouldn't have been here today. So I think early mentorship is key, not just in the undergrad, but even in the high school areas and getting those programs out there, because so many people have lack of resources or the ability to have those individuals that have sought higher education or have that ability. Many of my family members have not sought secondary education because they weren't afforded those opportunities. So that's key. Fortunately, I had parents that really allowed me to do that and provided the mentorship with other individuals and connecting with people that could get me to that point. So overall, mentorship programs, I think, are key in the future for achieving these numbers.
And when we're talking about achieving these numbers, I mean, how important is it for these med schools to reach students at a younger age? I mean, when is the appropriate time?
Well, I think it's critical. I think there's many programs out there that will go out and reach to undergrad, even some high school programs, and there's even elementary outreach programs that I have but our school supports and has our med students go out and reach to these elementary school kids to show them what healthcare is and show them that this is what the heart does, this is what the lungs do, to have that early mentorship opportunity to get the kids interested in medicine. That's number one. So those programs are out there. Should we do more? Absolutely, we can do more. I think the numbers clearly state that.
Would you agree with that, Rebecca?
Of course, yeah, 1,000%.
Okay, thank you both. Appreciate it so much.
It's my pleasure.
We do want to once again thank our guests, Dr. Jessie Bracamonte and Rebecca Soto Caballero, for this very important discussion. This crisis is not going to be solved overnight because it does require systemic change in recruiting more medical students at a younger age, finding Spanish-speaking doctors who want to work in Arizona, and understanding the needs of Latino patients across the state. But we will continue having conversations like these because they're important and they matter to you. I'm Catherine Anaya. Thank you for watching this special episode of Horizonte.